Embase is a multi-purpose bibliographic database indexing articles from biomedical conferences and journals and covers research in domains such as pharmaceutics, pharmacology, clinical medicine, biochemistry, and medical devices. Embase is often used when conducting comprehensive literature searches on topics concerning pharmacovigilance. According to WHO, pharmacovigilance is the science and activities relating to the detection, assessment, understanding, and prevention of adverse effects or any other drug-related problems. Because of that, Embase may be a database of choice for majority of drug-related searches. You may access Embase via PMU Library website by clicking the Databases tab and selecting Embase. The easiest way to retrieve information from Embase is to use a quick tab. Let's try to find the newest articles concerning stroke incidence of young adults in Europe. Note that Embase will always search through its controlled vocabulary and suggest us the most appropriate term. In this case, instead of keyword stroke, we should use cerebrovascular accident. At the right appears the number of records to which term cerebrovascular accident was assigned. To add another element of the query, we may either use a Boolean logics operator AND or change the search field in the second row to the right index. Custom time range may be set below. Clicking Show button with the number of records will redirect us to result page. To further modify our query, we will need to exclude results not discussing young adult patients. Similar to PubMed, to do so, we need to use filters available on the left. We will now expand the age filter and select young adult. Click Apply on top or bottom of filter menu to confirm changes. All available bibliographic data will be displayed in the middle, providing us with publication's title, authors, source title, year, journal volume, issue, and pages. If you're not satisfied with the results, but a single article seems to be relevant for your search, you may always click on Similar Records on the right. This will show you 100 articles chosen by Embase as fulfilling a query, giving results similar to the selected publication. We may also perform a query with help of the PICO framework. PICO stands for Population, Intervention, Comparison, and Outcome, and is a model framework used to ask exhaustive clinical questions for the needs of the evidence-based approach to medicine. If we do have a problem trying to form a meaningful query, we may always try to start with entering the answers for all or few elements of the PICO framework. Let's try to find out what is more effective in treatment of pharyngitis in children, amoxicillin or azithromycin. As population, we understand a disease suffered by a patient, pharyngitis. The position of the chosen term in Embase controlled vocabulary is visible on the left. By clicking the Add 5 Synonyms button, we are able to insert all keywords or, in case of pharmaceutical agents, drug trade names to our query. We can always remove selected words using menu on the left. Intervention is a substance or therapy used. Comparison, just like intervention, may be understood as an alternative substance or therapy. In the end, outcome is an observed consequence of performed actions. but it is not defined by our question and there is no need for one. By clicking Show with the number of records, we will be redirected to a search results page where we can further adjust our query by using an age filter. If we would like to find information concerning pharmacovigilance of a chosen drug or pharmaceutical substance, we may use a PV wizard form, a tool enabling a straightforward creation and monitoring of drug-related literature queries. Let's try to find articles discussing mesalazine. We should start by entering drug name to a search box and choosing preferred subheadings. The position of the term in the subject hierarchy is visible on the left. By clicking on the Next Step button, we will be able to select all name variants of the chosen pharmaceutical substance. Next, we may enhance our query by adding a default set of keywords and entry terms related to adverse drug reactions and so-called special situations. Finally, we may select a human limit and a time range to filter the search results. The query should include all articles discussing collection, detection, assessment, monitoring and prevention of mesalazine's adverse effects. Now we may apply all other filters available in a Search Results tab to further refine our query. Thank you for watching our video and see you soon.